Hi, I'm Dr. Siddharth Wayangankar, Director of the Cath Lab at Jacksonville Baptist Heart Specialist, and we are here today to talk about peripheral arterial disease.
Hey, my name is Raghav Gupta. I'm the Director of the PAD program at Baptist Heart. So Sid, what's PAD?
So peripheral arterial disease is actually the blockages of the arteries that are beyond the heart. So we've always heard about coronary artery disease, which is all the cholesterol plaque building up in the arteries of the heart. But when that same cholesterol plaque builds up in other arteries, like the leg arteries or the kidney artery or the arm artery or your neck artery, we call that peripheral arterial disease. So the pathology is the same, it's just the location is different compared to coronary artery disease. Dr. Gupta, our audience would like to know how common is PAD and what is the prevalence of this disease?
It's very common. Yeah, I mean, maybe not as common as the coronary artery disease, but it's actually we only know the tip of the iceberg. There are 400 amputations that happen daily because of PAD in US alone. So there's a lot that we don't know, that patients don't realize, and I think that's where there's an unmet need where we can help. Who's at risk?
So we look at the same risk factors the way we look at coronary artery disease, sedentary lifestyle, lack of exercise. But the bigger issue with peripheral artery disease is smoking. I always tell the patient smoking is like a poison to these arteries. So, and also the second thing is diabetes. So poor management of diabetes or poor control of diabetes and smoking are the two that I would say stand out, in addition to the other risk factors that we talk for cardiovascular disease.
Yeah. So this is very similar to what any kind of cardiovascular disease that we see as well. The same risk factors,
Absolutely.
but people just don't realize that. Yeah, absolutely agree.
So Raghav, we as interventionalists, we are more interested in treating, blockages. We call ourselves the plumbers of the heart and the cardiovascular system. So in addition to the procedures that we do, could you go over in general, what are the options our patients have with regards to the treatment for peripheral arterial disease?
Yeah, just like heart blockages and heart disease and peripheral arterial disease have come a long way in terms of what we can provide. And I think that's really where we come into place, is not only just we are doing procedures for these patients, we can always help them with medications and guided exercise program that have been shown again and again to basically decrease the future worsening of PAD. And so not only the medications, very similar medications that we use for heart disease, blood thinners, some of the medications increase the blood flow as well. And then on top of that, we help guide the patient in the right direction when if they need procedures. We do balloon work and stents in the legs as well. And we also have specialized devices which are basically made to decrease the plaque burden, which means that we can remove the plaque from the blood vessels of the leg as well. And then if we end up needing stent, we can always put those in there. And then on top of that, we would be we can always pivot the patient towards vascular surgery if they need further help. So there's options available, but the most important thing is diagnosis. And then once the diagnosis is there, we can always guide them in the right direction. But we're available to help.
Yeah, so I think that those are great points, and I think one of the things that I would like you to also emphasize is on the role of exercise, especially for PAD patients.
Exactly. That cannot be understated. The walking and exercise is probably the most important thing that has been shown, and many times you don't need procedures. So if you're seeing the right person early, once you start exercise program and starting the right medicines, many times the data has shown that you may not need any procedure done in future, and that will increase the survivability of those patients. Sid, we can do a lot of things for these folks, but there's still a lot of folks who I don't think they're getting diagnosed in the right time. And what if this thing gets missed?
If there is a peripheral arterial disease in the legs, people think about amputation and other stuff, but we have to remember that the biggest risk peripheral arterial disease, the number one reason people die is actually from cardiovascular, even though they have peripheral arterial disease. And in fact, studies have shown that if you have a significant peripheral arterial disease, then your survival is less than 5 years, which is, I think, a big point that we should emphasize in all our patients and our physicians who take care of such patients, because it's not just the risk of having leg pain, mobility issues, or amputation. It's in general, you're not going to survive beyond 5 years if you have such severe form of peripheral arterial disease. And then as disease progresses, yes, we talk about when somebody has critical limb ischemia, which is defined as so much blockage that patients have pain all the time, or they have wounds in their legs that don't heal. We define that as critical limb ischemia. Those patients, if left untreated, 1 in 10 of them is going to have an amputation in the next 5 to 10 years.
The point is that early diagnosis is the key. And as soon as we can diagnose it, we can start working towards a good plan for patients and help them out.
Couldn't agree more.
So Sid, like I know like PAD is not just the legs, PAD involves every single blood vessels like anywhere else going to the arm or the brain. So let's focus on the brain. I know that we're fortunate at Baptist Heart Specialists that you're leading the way, and like we have access to a nationwide registry for carotid arterial disease.
You know, every other blockage, whether it's the heart or it's the leg, or even if it's the kidney arteries, there's a blockage, then there's a symptom, and then the patients go to the doctors, right, to get it treated. But in carotid disease, if you do have a symptom, it's a stroke or a mini stroke, because that's the artery that supplies your brain. So these are the two carotid arteries, if you have a stroke or a mini stroke in the last 6 months, we call them symptomatic carotid artery disease. And of course, in those cases, those arteries need to be either fixed with a surgery, which we call carotid endarterectomy, or a stent, which is what we do here at Baptist Heart Specialists. Now, the other group, which is the majority of the group, is people who do not have a stroke or a mini stroke in the last 6 months, and they are labeled as asymptomatic carotid artery disease, which represents probably 95% of the patient population outside. And therefore, the burden is on primary care physicians and cardiologists to screen these people, because studies have shown that if you have more than 70% blockages, you are at a risk for future stroke. So I think this is where screening is useful, and if they do find some, they should send to Baptist Heart Specialist, where we can not just treat them with appropriate medications, but give them guidelines regarding who needs a surgery, who needs a stent, and treat them accordingly to prevent future strokes.
That's a great point. And do you think like the people who need to be screened are the people who have had a bypass or somebody who's had stents?
Absolutely.
Or leg?
Absolutely. One blockage at one place in the body, you always have a risk of blockage anywhere else. So I always tell people, you have blockage in one artery, you could have blockage in other arteries. So say you have a leg blockage, always make sure you don't have blockages in the neck artery, like the carotid artery, or even the heart. What should our audience be looking at? What are the symptoms and signs they should pay attention to that would help them seek help earlier?
Yeah, that's a good point. I mean, because that's it comes on to us to like, when should we go to the doctor? Kind of like with what kind of symptoms? So the most important one, very simple one, is like just aching sensation in the legs, like calf pain, thigh pain when you're walking, buttock pain many times when you're walking or standing up, and then when you stop, the pain goes away. That's like classic textbook symptoms of potential peripheral arterial disease. A lot of patients present with impotence as well, like they have problems during sexual activities. That could be one of the signs of peripheral arterial disease as well. A lot of times the patients will have like ulcerations in the feet, as Sid mentioned earlier. That is a little bit delayed diagnosis, but again, whenever you get a chance to kind of know what's going on, it's better so that we can help you treat it. Sometimes you'll feel like their hair loss, and the hair is not developing in the legs or feet. Nails are not growing. All these are signs of low oxygenation and low oxygen blood flow to the legs and feet. And so those are the things that you want to look out for. But anytime like you feel like there's one leg cold or versus the other, or something is just not right. I mean, you feel like, okay, I'm hurting a little bit more in one of the legs and something is not right, and like you've had a history of smoking or exposure, you just have high risk factors, and I would have a very low threshold to contact your primary care doc that, hey, I'm worried about peripheral arterial disease, what do you think? And that's the only thing you have to say.
And I think that those are all great points. And one thing I would add is, if you do have peripheral arterial disease, especially in the legs, make sure that once you have it, you always have it. There is no cure for any of the atherosclerotic disease we have. So I always tell my patients, wear good socks and shoes, get good protective footwear, because if you injure yourself, it takes time to heal.
Absolutely.
So that's another key point.
Excellent. Yeah.